simple or easy answers is very clear. And the fact that what we start off with, that as each of us who are in different ways, very bad analogy of blind men and elephants, looking at different parts of the whole and trying to find the solutions. The need for all of us to be more sensitive to the other point of view is, if that is something that we can take away from here, that itself would be learning enough. We're going to go on from here. And as we promised, we're going to keep you here very late. But we'll go on and we'll try and do the next session as quickly as we may. What I'm going to briefly talk about how institutionalization is not a good idea, about why deinstitutionalization is a good idea. We've talked about why you might have to live with institutionalization, and what is the answer? What is the where do we go from there? Obviously, we don't have the answers. We don't know. But the way that I would look at this very briefly is to look at the story. What is it that we have learned about this? As Mohan yesterday in his presentation and briefly Vandana talked about, the way that we can learn from what has happened is to learn from other people's experiences, our experiences and other people's experiences. I'll start very briefly with my disclosures. I'm, as you know, a medically trained psychiatrist. I'm currently a fellow at Murthy, so I'm doing research on history, and as part of that, I've been looking at the history of mental hospitals as well. I just want to acknowledge my friends, colleagues, Sanjeev Jain, Dr. Murli Sharma, Pratima, who very happily shared a work with me, the Murthy Museum, and of course, all the people that I've worked with. There's a book which was published recently in the US, very recently, a few months ago. It's called From Sanctuary to Snake Pit. It's a coffee table book by a photographer called Christopher Payne, who has looked at the tearing down of mental hospitals. He traveled to 70 hospitals across the US and has recorded the histories and what has happened in these hospitals. The commentary is written by the man who mistook his wife for that? The man who mistook his wife? Oliver Sacks. The commentary is written by Oliver Sacks, and it's stunning photographs. This is an old mental hospital. Hospitals were asylums, sanctuaries. The original hospitals in the West, as in India, were places of sanctuary, where community built the hospitals with philanthropy, where at least from what we know, lots of things happened. This is before medical treatments. All sorts of interventions, all sorts of therapies, all sorts of activities, many very diverse sorts of activities used to happen here. The old hospitals were almost like museums and libraries. These are the gardens of one of the old mental hospitals in the US. Very soon, however, things changed. Okay. Okay. Very soon, things changed quite rapidly. In locked and go of people who've been dumped by the families. They died in mental hospitals. These are their ashes in urns. Nobody came to pick up after leaving the people in the hospital. So This was in the US. There are numerous places in the US where this is one of those earls. And soon, of course, they deteriorate quite badly. This is the people in one of the hospitals. This is what they look like. They haven't been torn down yet, but they're pretty much in the process of, they've been shut down and the buildings are being torn down. Sorry.
Escape button.
The last one is one which is in the process of being torn down, and this one is obviously decrepit. This is what the hospitals look like. What is it that brought about this change? What went wrong? And essentially, what is the reason for this is something that we are still trying to understand. The story of mental hospitals in India is actually not very much different. In fact, mental hospitals traditionally, the Indian mental hospitals are of the same vintage as the ones in the US, and very similar to the ones in the UK. The story of the UK mental hospitals is another similar story. They've all in the process of being torn down. Hyroids, which was one of the largest, was closed, which is a village by itself, was closed a few years ago. And the circumstances around it and what transpired after shutting it down has been captured very beautifully in a BBC film which is called Sounds Mental, which is available on the net, which anybody who's interested in it should actually have. It's a long film, it's about 90 minutes, but it's a fascinating film to watch. The story of the Indian mental hospitals is actually very similar. The first one, by the way, was started here in Chennai in 1793, a private mental hospital. Soon, however, the East India Company took them over, and then they all became run by the British government. Initially, at least, the records or the reports that we read are fascinating. The ones from Ranchi, Ranchi, as most of you know, there were two. There was an Indian mental hospital, and across the road there was a European mental hospital. The European mental hospital was meant only for Europeans and was supposed to be the pride of medical care. The report, however, is from the Indian mental hospital, which was the superintendent of which was a gentleman called Major Dhunji Boy. He writes, and this is, please don't forget, this is 1934. He writes that in the mental disorder, it is the patient himself who is being treated, not so much other parts of the body, and that is why the personal factor is so important. It is essential to try and see the world as the patient sees it, and to accept, for the time being, the reality of his abnormal experience, and to stand alongside with him in his difficulties. Viewed through the lens of 2010, does sound a little, not a little, paternalistic and patronizing, but viewed from the lenses of 1934, this is actually surprisingly forward. In fact, the reading, and I could go on forever on this, of these records is fascinating. We talk about one patient where the person wanted to commit suicide. He wanted to die, but he did not want to kill himself. He asked everybody around, whoever he came in contact with, to kill him. Obviously nobody did, so he stopped eating. And as Dhunji Boy says, he went on what is